Hey guys, Dr. Greg Van Vacaris here. I hope you're all holding up during this pandemic, and I wish you peace, joy, and some time to really open up your hearts to the world and yourselves. And today we're going to talk about 10 different things you can do right now to help either prevent low back pain or to help low back pain you might be having because you're home all the time. So let's start with them. Not going to take too long. Number one, let's talk about your sleep position. Sleeping positions. We do not want to sleep face down. When we're lying face down, our arms are up, our neck's torqued, and our low back's being compressed. If you look at me on the ground here, and we lie face down, gravity is always going down. So it compresses the joints called facets in your lower back. Put our heads down like this, or like this, which most of you athletes know this position. It's terrible for your neck, creates a lot of tension. If you're waking up every day really sore or tender in your neck or your low back and it's hard to bend over the sink in the morning to wash your face or brush your teeth, you want to change your sleeping position. So what we're going to do is either sleep on your side, grab a couple pillows here, and you want to pillow that fills the space between your shoulder and your neck. So it keeps you nice and neutral. Take another pillow and let's put it between your legs like this so your hips don't roll. That way we stay in a nice neutral position. Keep our arms next to us. Do not raise your arm over your head. It creates a lot of stress on the shoulder girdle as well as the neck. So this is a neutral position, or we lie on our back, the pillow underneath our knees, and this keeps some tension off our low back. Hands down here on your belly. Do not put your arms over your head. I know it feels comfortable, but over time it's going to cause stress on your shoulder joint, and we want to be aware of that. So, number one, change your sleep position. Number two, a wallet. If you are, I'll get a chair here. If you're sitting on a wallet in the back of your pocket, it's like putting a 1 or 2 inch, depending on what you put back there, hinge underneath there, and it'll shift your hip up. And sitting like that's going to distort your hips, distort your lumbar spine, and create a cascading effect all the way up towards your neck. And so we want to make sure that we do not put our wallet in our back pocket. When we sit down, we put it in our front pocket. If you want to know if you've been doing it, or if you want to see if your partner's been doing it, look at their pocket. Their back pocket will have a big wearing away sort of feeling, texture on it, and you can tell the pocket will usually be a little bit stretched out as well. So you want to change that position. Throw it in your front pocket when you sit down. Number three, we want to talk about sitting positions. So when we're sitting, back to this chair, here's what we don't want. We don't want to sit like this, keep upright posture. We also don't want to cross our legs too long. If you find yourself crossing your legs, this is very comfortable for most people. We want to switch sides. Otherwise, we get this one side or unilateral pulling all the way through the low back and hips. So if you are a cross-legged sitter like this, just make sure that you switch it up. And you'll see that one side is more comfortable for you because you've been doing it for a while. So either this neutral position, or if you're going to cross legs, don't cross this direction if you can. If you're going to do this, you're going to switch sides and try to keep it even. Okay? When we're from the side view, sitting up, we're working on our computer, elbows at about 90 degrees. We want our wrist to be and our hands just lower than our elbow joint. If we raise it up, we're going to do this with our shoulders. That's going to create more stress in your neck and your upper back. So sitting up tall, elbows 90 to 110 degrees, down a little bit, and that's your position. Really basic. We want to talk about imbalances in training. So many of us are always training our core, right? Everything's a core, it's just the deep abdominal muscles. But we want to look at, there's a strap that goes all the way around here. So if you are doing a ton of hanging leg raises, jumps, crunches, bicycles, you also want to turn over and do some extension work, bird dog work. You go look up bird dog. It's actually this position. Hands on all fours. I'm not going to go too detailed. We're going to reach and hold, and then you'll reach and hold. It's a little beyond this right now. We'll go over that another time. But look up bird dogs. Look up bridges for your glutes and your lower back. And we'll talk about that at a different time. But start to balance that out. You want to balance the anterior and posterior musculature. Otherwise, you start to have these imbalances. It stresses your hips, causes some problems. One more thing we want to talk about here with sitting. Let's get back to this. When we're in this position, from the sideways position, These muscles are shortened. They're called the hip flexors. When we sit, they shorten. The muscles in the back of your legs or posterior thigh are called a hamstring group. They're responsible for curling your leg. When we sit, those shorten because the knee joint is bent, the hip joint is bent. So when we stand up from that position, if those are tight, they pull. And you'll see sometimes if you're getting out of a seat or out of your car and it's hard for you to get all the way up, after about 20, 30 seconds, you can stand all the way up and start to move. It's typically because you have really tight hip flexors, or most likely called the psoas, P-S-O-A-S muscle. Look that up online, P-S-O-A-S. That and your hamstrings. So if you find that you're somebody that has sort of chronic irritated low back, here's what I want you to do. Every time you've been sitting longer than 20 minutes or a long drive, you're gonna get out of your car or get up from your seat. If you can, just put your foot on the chair or on your bumper, and you're gonna lean into it nice and easy. Hips stay square, don't turn and torque, nice and square. If that's too hard for you, it's okay if you bend your knee a little bit and come down into it. We wanna start stretching that. So we do that on both legs, just for about 30 seconds. And then also, if you can, we're gonna go into a nice, easy lunge. And you can put your knee on the floor if you want to. If you're somebody that has knee issues, then put a pillow on the floor next to your workstation or sitting station, and that will help so you don't put too much pressure on your knee. And we're gonna move forward. It might be easier if I do this leg. And you wanna stretch. We're gonna stretch the hip flexors. So we're just gonna hold this again for about 30 seconds. Nice, easy stretch, just to open those muscles up. That way, when you're sitting, you don't start to have these adaptations, which over time start to create some stress in your lumbar spine. Will help a ton. Next, we want to talk about footwear. So many of us are wearing shoes. I'll take this off. Hard shoes, soft shoes. If you look at the bottom of your tennis shoes or whichever shoes you wear the most, this is where my big toe is. This is the outside of my heel. If you look under the outside of your heel when you turn it over and you see it's worn away, and then when your big toe is underneath the shoe is worn away, you'll see the difference in texture on there. It's usually really smooth. Then you know you're walking what's called a pronated gait. So you land on the outside of your foot and you roll in. And when we do that, we'll just pop this back on so you can have a better idea. Bear with me here. So when we do that, if my foot lands on the outside and I start to walk, see how my knee, as I do this, my knee starts to bow in? It doesn't stay straight, it'll roll. And when that rolls, all these hip muscles have to contract to try to right you and put you in a straight anatomical position as you're moving. These muscles will start to get really tired, start to fatigue, you start getting trigger points, start to get a little hip pain, low back pain. This is a really common way for people to get iliotibial band syndrome or IT band or tight outer muscle tendon issues here in their hips. Causes sometimes bursitis over time on the hip joint if you're an older person that's been doing it for many, many years. So if that's the case, if it's a pair of tennis shoes, I want you to get 2 pairs of the same tennis shoe so that they last a lot longer, and also you swap them every time you use them. If you have some work shoes or some dress shoes, then you need to go to a place where they will change that shoe heel for about $15. They just cut it off or clip it off, put a new one on. It'll take away a lot of that hip discomfort. Super, super, super common. Next, we have holding your kids. If you're a young parent and you're holding a child all the time and doing this, shifting your hips, I want you to shift sides. If you can start this when your child is young, it'll benefit you and the child tremendously. If you start this as a child 6 months, 8 months old, they're gonna feel your instability and they're gonna wiggle a lot and you're gonna shift them right back over to the other side. So, see tons of patients, especially patients with young kids with upper back issues and hip and low back issues. If you see from the side, if I shift over, you see that imbalance coming up through there. There's a lot of weight pulling on the shoulder, and so everything starts to get out of balance. Think about it. Switch sides anytime you can. Just try to get comfortable with it. I know it's hard. I have young kids. Next, walking dogs. If you have dogs that are over 15 pounds, I say that because 20-pound dog, when they put their body weight down and start moving, if they're not well trained on a leash, they're always yanking you. And that yanking will tweak your shoulder, your neck, and also your hips and low back. So get used to training them so they don't go much further in front of you. And also, if you can, switch sides. We usually typically have them on one side because we're looking at where the grass is and where they're going to go to the bathroom. I have almost 200 pounds of dogs. So I walk them both, but I typically walk them in the street. It's safe in my neighborhood because it's a wide street. I don't recommend it in a busy street, but it has them pull evenly or they stay close and tight. That asymmetrical pull will put a lot of stress back there. So I want you to drink a lot of water. So water, your muscles are about 70% water. Dehydrate by even 3%, you get spasms, weakness, sometimes both. Typically we take 50% of our body weight, we make that ounces. So if I weigh 150 pounds, I would take 75 ounces. That would typically be my hydration for the day. Now if you're training, you're gonna boost that up. But that's sort of a gauge. You can also look at the color of your urine. You want it to be a light colored yellow to sort of a clear color. If it starts getting darker, unless you've just had a bunch of vitamins or you've had a lot of kale and asparagus, then you want to increase your water, okay? If you have high blood pressure, I want you to be really mindful of this. I don't want you to try to shoot all those ounces in at the end of the day if you didn't get it in during the day. That's going to increase your blood volume, and that's going to cause higher blood pressure. So we want to just think about all through the day, maybe every 2 hours, drinking some water, 8 ounces, whatever it is that shifts for your body and works for you is what I want you to work on. We want to talk about also, at this time, emotional stress. Very difficult. There's a strong correlation between the way we feel emotionally and the way we hold tension in our body. You'll see a lot of people in this position. You see a lot of people clenching back here. You see people doing this because they don't feel so well. Right now, during this pandemic, it's another type of epidemic of disorders with people being depressed, being extremely anxious because there's so much insecurity and unknown going on right now. So I want you to think about that. Try to find some type of app. There's some great apps online or on your phone that are meditation apps. There's some really nice meditations that are going to take you into the sleep hours, so you can just listen to them, or you can learn a traditional style of meditation and understand on your own. Or if you're really having a tremendous amount of anxiety, there are plenty of therapists right now that are working overtime and are getting overloaded, but I'm sure they'd be happy to help you and give you some techniques to deal with the amount of stress and triggers that are occurring right now. So, one more thing I want you to do is keep moving. This is the 10th thing. Keep moving. Don't sit in your house or your apartment or wherever you are all day because you're afraid to go outside. Stick on a mask, 6 feet away, go for walks in your neighborhood. Get out, see the sun, see the sky, smell the flowers. Remember, this is gonna change, it's gonna move. This pandemic's gonna go away, but we are still here. So how we act during this time, what patterns we set are gonna continue. So we wanna still stay in really healthy patterns so that when we're allowed to go back to work, we're allowed to be social, we don't feel all that discomfort, we don't feel like we're closed up, we're open, we're ready. Like I said, let's share love, joy, peace. I'm thinking about you guys. Take care. Any questions, just shoot me an IM, okay? Take care.